Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Crinan-Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Happy Q&A day. We do also like to celebrate some wins in the program. So this week we are celebrating Jackie. She started the program at 90 out of 132 and is down to 6 in only 6 months. So that is amazing for Jackie.
Full recovery.
Yeah, both today. Susan started at 85, is down to 11 in 4 months only. So like 4 months, 6 months, and your whole life gets turned around and you're back to doing all the activities that you love after months, years of living with PCS. So congratulations to both of those members. Otherwise, we can go over with our first question.
Yes, thank you. Can you hear me?
Yep.
Okay, perfect. So my question is related to brain fog. So a few weeks or even, maybe 1-2 months ago, I started to feel increased brain fog, like actually for 2 weeks in one row, 24/7. And it got better afterwards, but I still have it increased and more than before. So my accident was in December 2023. So I have PCS already for 1.5 years. And what I notice, it gets especially worse when I'm on the screen, like especially on my phone, but also on the laptop and something like that. So I noticed already that VOR helps me. So when I do those exercises, it helps me. But is there maybe anything else that you can recommend, or also how to handle it? Should I avoid being on the screen? Should I be on the screen? Like, what's the way to go?
Yeah. So with screen, let's talk about brain fog first. So brain fog can be related to inflammation, right? So that's like diet, gut, sleep, all that stuff. So if you have like a terrible night's sleep, you could end up feeling really foggy. If you have, increased inflammation, you can feel foggy. If you have autonomic issues, you can feel foggy. So things like, exercise, but also just being in kind of fight or flight, right? So, the breathing exercises, the vagus nerve stimulation, things to kind of calm down the nervous system can help. But then you have the other things like even neck dysfunction can result in that fogginess. Cognitive problems can be a result of neck dysfunction. And then when it comes to screens, also you're dealing with, if it's more like the light sensitivity from the screens, then usually that's related to kind of autonomic, but it also can be related to neck. And same thing with the motion of screens. So if you're scrolling and that's the problem,
that's my problem, yeah.
Then it's likely visual motion. Now that can be related to, that could be a visual problem, or frequently it's frequently that's also a neck problem, because the neck dysfunction is affecting how your eyes are able to move and track things, and therefore you get altered signals from your visual system versus what your neck is saying, and you feel kind of off. So it sounds like there could be a few potential avenues or things that are affecting you. Do any of those kind of resonate with you?
Yeah, for sure. The motion topic. So for sure, it's something with the motion, especially like scrolling around. That's really tough on me, and I think that also I definitely have issues with my neck. I can feel that. I also start to get it treated. I'm not sure if it's the right treatment, but at least I'm trying. So, and I'm also trying to work on my vagus nervous system. So that's also what I'm trying to do.
Have you watched the manual therapy videos that I have in the resources?
No, I think not yet.
So if you go to the resources, go to my folder,
Mm-hmm.
and you go to, there's a couple of recent videos I did called Manual Therapy Part 1, Manual Therapy Part 2.
Okay, perfect. Mm-hmm.
Watch those, because it talks about neck function with visual motion, and it'll teach you kind of how that works. But also I have examples for like what you're looking for treatment. And I have an example of me treating somebody, so you can see exactly kind of what I do. And then you want to try and see, like, is this what I'm getting or not? Are they getting into the right places? Because that might just give you ideas to tell your practitioner to be like, hey, what about treating this area? And just to make sure that you're kind of maximizing the treatment you are getting. Because most practitioners are not good at treating the neck. Like I saw a patient here, which I don't do very often, but every once in a while I'll see somebody. And they had gone to like 3 of our other clinics in the past. And I treated his neck, and he's like, no one has ever done anything like that. Right. So a lot of people say, well, I've had my neck treated and it's either not helping or whatever. They said it's fine. But even still, there's probably some issues there. But if you look at that video, you can kind of see, like, is this the right type of treatment?
Okay, perfect. Thank you a lot. That's very helpful.
Okay. And then the rest of it, yeah, is autonomics, diet, gut, sleep, right? Trying to calm the nervous system. That's all the other brain fog things.
Okay, thank you.
You're welcome. Go ahead.
Yeah, thanks a lot. So I'm currently in the middle of the diet module, and I already started like a couple of months ago to avoid gluten as much as possible. But I haven't been like 100% gluten-free. So I use regular soy sauce. Sometimes I have a bite of my girlfriend who's like eating regular pasta, but not much. And now I'm like doubting, should I go like totally like 100% gluten-free. But the thing is, next week I'll be on a holiday with other people, and I'm not sure if I can like determine every meal that I eat there, because other people will cook, and so I'm not sure if I can be like following the new diet like 100%. So I'm wondering, what should I do next week? But also, would my gut maybe already be like restored from avoiding gluten as much as possible, or should I really like go 100% and following the diet like fully?
Okay. All right, good question. I missed the first part. How long did you say you were being gluten-free?
Yeah, for I think 2 months, something like that.
Okay. So more or less you're gluten-free. And how often were you kind of having a little bit from your girlfriend? Is it like a couple times a week type of thing, or is it like a couple times a month?
No, I think a couple times a week, and also like I use regular oatmeal instead of like 100% certified gluten-free. So I'm not sure. Yeah,
Okay.
I'm not sure how much gluten I take actually. Yeah.
Yeah. Okay. And then lastly, when you've been following this diet for the last 2 months, have you noticed that there's been any sort of improvement in any way, despite the fact you haven't been totally gluten-free?
Yeah, so the difficult thing is that I had a setback 6 weeks ago to a hit to the head. That makes it difficult to like compare, but I do feel like following a better diet has helped me. Also, my stomach feels more at ease. So I do think it works, but yeah, I'm not sure how much. Yeah.
Okay, so I think probably the best approach, because you are going on vacation, is my suggestion is try to be as diligent as you can for, you said you're going in a week?
Yeah.
So maybe try to be like 100% gluten-free between now and you leave. Okay, so just a short period of time, 1 week. And then when you're on vacation, you're obviously not going to start eating a whole loaf of bread, but you're going to eat a little bit more. And you can use that as a bit of a gauge. The other option is that if you don't want to do that reintroduction during the holiday, which I think there's some merit to doing it before, because in case you do get a reaction, you'll know when you're gone a holiday if you should be really diligent or not. So maybe the other option, and you can kind of see which one resonates with you better, is you just start eating a little bit more gluten now. And so instead of having the bits and bites here and there, you can try a little bit of just like sourdough bread, something just really clean, like just a regular type of organic pasta, for example. And then just see if you notice a difference. Still try to stick to the rest of the Concussion Fix diet, but there really is merit to a graduated reintroduction. In general, I will tell you, based on my clinical experience, people do really need to be 100% to really notice that full difference. However, I think because you've been doing it for so long and you have this vacation coming up, think of this as an opportunity for you to kind of test it out. Now, if you come out of the next 2 weeks, so like this next week when you reintroduce, and then when you go back on vacation, you come out of the 2 weeks and you're like, you know what, I'm actually feeling worse, and maybe this diet was doing more than I think it was. That's when you can go back and saying, you know what, I'm going to take 3 weeks, I'm going to take 3 or 4 weeks, I'm going to be hardcore when I get back. And then you're going to be able to tell very clearly, because you're coming off something that you've eaten after you've kind of avoided it and then really avoided hardcore. Then you're going to know really what the reaction is. Or option B is that if you don't really notice the difference, then maybe you could just continue with kind of a minimal Concussion Fix diet with having a little bit of gluten involved, and then kind of slowly start reintroducing things back in. But the big things that we emphasize on the Concussion Fix diet: no sugar, no alcohol, no gluten. Those 3 things. And I think sugar and alcohol, it's not that people are so much sensitive to them, it's just that these are things that are quite detrimental to your neurological recovery, period, independent of the allergenicity and the immune system response. So does that make sense?
Yeah, that makes a lot of sense. Yeah, I can use it.
Good.
Thanks a lot.
Good. Yeah, no problem. Enjoy your vacation.
Yeah, thanks.
Now, one thing I've heard you say before, Paul, is like if you follow the diet like 90%, you'll get like 10% of the benefit. And if you follow it 100%, you'll get 100% of the benefit. Now, a lot of people will send me a DM and say like, oh, I followed the diet more or less, right? But it's like, I always think like, okay, well, be diligent for a good period of time. Right?
Well, that's kind of what I was referring to, where it's like, I don't think that the diet was ideally followed, where where we are 100% avoiding, because sometimes the effects, again, I've said this before many times too, sometimes the effects are very obvious right away. You follow the diet, even just making the big changes without being 100% following a diet like was just describing, you're going to see benefits. You're eating a richer diet in antioxidants, you're eliminating a lot of the processed foods, you're hydrating more. We're emphasizing that a lot, especially in the new program. You're going to feel much better. And then there's a third of people, and this is, I think, where that comment about the 90%, 10% benefit is, a third of people don't really get the benefits until week 4 to 8, somewhere in that range, where it's like you kind of need to stick to it. And then all of a sudden you start realizing, wow, yes, like I've actually lost that 10 pounds that has just been hanging around on my gut for a long time. I feel lighter. My gut symptoms have changed substantially. I feel more energized. And so it's sometimes tougher to associate that to diet, Cam, because it's not immediate. right? It's not like they get a neck treatment, they feel worse or they feel better. That's a very cause and effect type of thing. That those types of like the middle third of responders, that's harder to differentiate, and you really don't fully get that until you actually go hard. And when I say go hard, I mean like be as 100% as possible. If you're having like a little bit of pasta here and a sandwich on the weekend, your immune system really can't fully reset, which is why I think considering, if Bryce wasn't going on vacation, I think my suggestion would be, you know what, like take a shorter period of time, maybe it's 4 weeks, maybe it's 3 weeks, and go really hard on being 100% gluten-free. And then at least in your mind, you can say, I've done it, and that's not a possibility. Because if you don't, then you're always going to be kind of like wondering, well, could it be gluten? I kind of did the diet, but I wasn't 100% on the diet. It's kind of like with your treatment. It's like, I did neck therapy, but did you do it properly?
Yeah.
No, you actually kind of did it halfway there. And so that's where it's like, once you do it 100%, then you're going to really know or not know, and then move. It's going to help you to move on to the next thing or really stick to it.
Right. Okay.
Yeah. Good question, Bryce. A lot of people have that question being like, do I really have to go hardcore?
Yeah. I always tell them yes. I'm always like, yeah, like do it hardcore, because then again, you eliminate that possibility, or you find something out. Like when you start reintroducing and you have something and you're like, oh, I get a headache when I eat like, even with me, it's like I'm not necessarily gluten-free, but I don't eat a lot of gluten anymore. But when I do now, like it's like the kids will have pizza and I'll be like, yeah, sure, I'll have a couple slices of pizza.
Sure.
I notice that I'm like immediately like bloated and I'm like, oh man, this affects me.
Yeah.
Right. But when you're just kind of always eating it, you don't even realize it. But when you take a break, then you're like, oh, you just realize how good you feel. But it's oftentimes you don't notice how good you feel until you do the reintroduction and realize that you feel worse.
That's
And
right.
so that's kind of the idea for me, is like, let's get people to be fully diligent for like 6 weeks and then gradually reintroduce to see what breaks. And then you're probably going to notice it more because you've been so clean that you're going to notice, oh yeah, that makes me feel foggy, lethargic, bloated, whatever.
And that I think only really works when you did the initial hardcore approach, where you you eliminated everything, you healed a lot of the allergic symptoms you had and your gut symptoms, and so that got a lot better. But now you can make those decisions eyes wide open, realizing, hey, you know what? I know I'm going to be a little bloated and gassy, but I got over the initial issues I had. The thing is that you can't take this like everything in moderation approach when you're still trying to heal your brain and heal your in your recovery process. You can take the moderation approach after you've kind of gotten through most of the recovery, and now you're in kind of what I would term maintenance mode, where it's like, you know what, most of my symptoms are gone. Now I'm working just on strengthening and just being healthy. And now if I have that pizza, I know it doesn't do me well, but at least I know what I'm in for, and I know what I need to get back to feeling better. Instead of being like, I have pizza once every couple of weeks, I just continue to reset that cycle while I'm still trying to eat. That's hard.
Right. Yeah, that's what I mean. That's why I think people should try to be hardcore for 6 weeks.
Yeah.
Because then it's like, now you fully realize like if it's an issue or not, especially when you reintroduce. And then the other question that I get all the time from people is, well, do I have to live like this forever? And my answer is like, well, no, you don't have to live like this forever, but you may find out, like, for example, like I use my asthma example, is that like I have inflammation and it presents to me as asthmatic type symptoms. And if I eat clean, I don't have any asthma symptoms at all. I can run for miles, I can do whatever, and I never need my inhaler. But if I sit down and have like a bowl of ice cream with my kids, I'm wheezing immediately. So the question is, do I have to avoid ice cream forever? Well, no, but I know that it's pro-inflammatory now.
Right.
And I know that it causes my symptoms to increase. So the question is, what do you want? Do you want to be clean and not have symptoms? Or do you want to indulge every once in a while just knowing that it's going to impact you? And that's a decision that you have to make
100%.
personally, right? But by doing that exercise, you now realize what things are inflammatory for you. Because the thing is, if it's causing my asthma symptoms, it's also damaging my vascular system. It's also causing all sorts of, potentially neurodegenerative changes in my brain if I continue to eat like that. So It's just what path do you want to go, right? Like asthma is the symptom it presents for me. Other people might, and I also feel some joint pain, right? Like if I have like, some wine and some pizza, I'll notice that the next day my knuckles are stiffer, my hands are stiffer. I'm like, oh man, it gets into my body and it's just inflammatory. So yeah, it kind of causes you to just try to be more mindful and healthy, which is I think a good thing overall for the rest of our lives.
It's good for people to hear that type of kind of anecdote and story, Cam, because you've done the work up front to figure your things out. However, I think a lot of people that are listening to this, they're probably like, how do I get to the point that you've just described where I like really know what's my triggers? And so like I've said before, there's really two main ways of doing this. And with the Concussion Fix program, we kind of go down the elimination of a couple key inflammatory foods, sugar, alcohol, and gluten. Those are the three things that we focus on. And then we reintroduce those. But there could be other things, like you mentioned dairy is your thing. You've also known about your egg allergy for a long time. You've said that publicly. Mm-hmm. For me, it's eggs and dairy as well. And again, similar to you, is like, I know what happens when I eat those. And I can have a little bit of like charcuterie cheese here once in a while. I'm like, I know that my digestive system is going to be off after I eat it. And so like I made that decision. And so if you feel like you're having more inflammatory symptoms, more aches and pains, more tendinitis, for example, then you can cut back on that. You can really clean things up. The other way to differentiate and figure out is actually do some blood testing. And I think we started with you with some blood testing too, just to get started being like, what foods are really creating an immune response? Because I think the frustrating part is, we can guess with gluten. That's the most common one, especially with neurological issues. But there could be a whole host of other things. Like I run these food sensitivity reports every single day with patients. And then we come back and say, wow, I didn't realize almonds are my sensitivity. Yeah. Or, a whole host of other foods. Yeah. So you have to look at this like data collection about your own body. And one is kind of like the longer term and one is kind of the immediate, but you have to pay for that testing, obviously.
Mine was all beer related things. It was like yeast, barley, gluten. Yeah. I was like, oh man.
I know. Well, there's other options for you, Cam, luckily.
Yeah. Now it's wine. But it's for me, it's like it's sugar. It's like if I have any sugar, that's it. And I mean, gluten to me is like just another sugar, right? Like it's basically, if you're having a sandwich, it's 2 slabs of sugar with something inside it.
Funny enough for me is like, I actually am not sensitive to gluten. Like if I eat like sourdough bread, I don't really notice the difference. For me, it's much more so chocolate actually is one big one, like cacao, eggs and dairy products. And I can handle, like gluten much better. But beer also absolutely does me in too. And I just checked, so that's like tragic.
I just get a big barrel belly like within minutes after drinking. It's like, oh my God.
The bloating.
Yeah, the bloating.
Nikki, did you wanna chime in here? I see that you turned your video on.
Oh, no, I was just liking the discussion. And I agree though. I followed the diet when I was doing the program, but also afterwards. I love to do it just once a year at least for a good 3 months as a reset. So and I know my own sensitivities now too. For me, it's actually on top of my normal fish and tree nut allergies. I use a lot of flaxseed, chia seeds, hemp hearts, sesame seeds, and I have noticed that I'm sensitive to those. So again, right, it's that individual is super, super, super important, that even if something's healthy, it doesn't necessarily mean it's healthy for you. So keeping that in mind.
Since we don't have a ton of questions, I thought I would just share this document, which I share with my patients all the time, just to kind of explain what food sensitivities may cause in your body. Now, again, doesn't mean that you have all these things, but just pay attention here. There's 4 different columns here, and they're each representative of a different immune system in your body that creates a response to anything it sees. This could be something that's on your skin. This could be something that you eat, something that you breathe. The one over here on the right side, IgE, this is the most common one that everyone knows about. This is what allergists look at. And so this is where they would actually do like a skin scratch test or one of those like needles, and you'll see, is there any red reaction? You can also do a blood test to figure out if you're IgE, but this is quite obvious because it happens immediately. And there's a particular type of immune system called eosinophils that are increased if you have lots of these. So you can see there's some things that are the typical anaphylaxis ones, like mouth tingling, shortness of breath. But then there's some other ones like reflux. So sometimes people that have silent reflux, especially after they eat a certain food. I had a patient yesterday, for example, with silent reflux. This is kind of like that throat irritation. That can happen after eating a food and can be related to IgE. Most commonly, people have some sort of IgG reaction. Now, this immune system is not immediately acting. It's a slow acting immune system, and it kind of comes on within a couple minutes to hours, and sometimes even days. So IgE is like seconds and minutes. IgG is like hours and days. And it also takes longer to resolve as well. And so look at the host of different things a person can present with here. So a food you could eat may cause fatigue, headaches, changes in your skin, for example, like eczema. I see that a lot. Bloating and gas, that's the obvious one. Everyone associates foods with GI upset, so constipation, diarrhea. But then things like joint pain, weight changes, mood changes. This is a common one. I've even seen things like hot flashes get worse with certain foods that people eat, over and above the things like red wine and spicy foods. And then even things like insomnia and anxiety. So it gives you a snapshot of, it's not just your digestive system that might be off with actually avoiding some of these foods. And so there are certain tests you can do, and this is one of the questions that was asked in the chat. You're looking for an IgG test from a very reputable laboratory. And so there's a lot in North America and Canada. I can put a few that I vetted and I like here in North America that you can check out. And obviously what you need is a requisition from your doctor to do this. So a naturopathic doctor really knows this. Most family doctors will defer to allergists. They don't really deal with this stuff. And they often, just so you know, allergists will say, oh, it's only Ig. Everything else is nonsense, which I think is the total BS cop-out approach, because we know there's lots of immune reactivity to these other immune systems. So just to give people an idea, a lot of different things can happen. And then, of course, IgA and IgG4 also have other things that are associated with them, but the most common one is IgG.
And just going back to that, you want to pull that up again there, Paul?
Yeah,
if you
sure.
look at that IgG column and you see like, joint pain, right? And now you can relate this to like headaches and even neck dysfunction.
Mm-hmm.
And people often come into the Concussion Fix program and be like, oh, it's my neck. And they try to skip ahead to neck. But the issue though, is that if you have inflammation in the joints and muscles and tissues of your neck, and you haven't fixed diet and that inflammation lingers, that neck treatment is going to be a waste of your time, because the reason it's there is because of the inflammation. And oftentimes just by clearing that up, the neck pain and headaches and other dysfunctions in the neck can go away. That's why we always put that stuff at the end, right? The rehab stuff is at the end, because if you don't create this good foundation and you have the foods you're eating are basically going into your joints and causing them to be inflamed, that's going to cause that referred pain into your head, your face, whatever. And that's going to impact your visual motion and whatever. So that's why it's like, just because you think it's your neck doesn't mean you have to go right to neck. Work on all this other stuff first to make sure that everything is clean, and you have to be diligent on it and stick with it and figure out if there is anything there when you reintroduce. Anyway.
A common thing that I see is often people will go for treatments, Cam. They'll spend lots of time and money and they'll get temporary relief, but then it always keeps going back to their baseline. So if you're stuck with that, it can be one of two things. Either the practitioner is kind of onto something, but not really getting to it, or it could be some sort of metabolic obstacle that's holding you back from fully resolving this type of inflammation, especially if you have like multiple joint pains. Like Cam said, like, my all my hand joints are a little like sore and tight in the morning. Okay, that's a sign that there's some sort of inflammation that the body's dealing with that's systemic. That's not actually just like it's one particular joint. Like, my whole neck is sore after like a weekend of just kind of eating a little bit more loosely. So anyways, I think we have some good points here for people to take away. All right, you're next.
So I just have a few questions. I was tested and I have like a mouth bacteria. It's actually not a really bad one, but obviously the dentist will deal with that. But they weren't that concerned. They were like, well, when you come in for a cleaning, we'll do ozone as well, but I'm not going to go in for a cleaning again for like 5 months. But I also felt something going on in my mastoid bone and my ears for like years, and I'm wondering. I, I'm just I'm just wondering, you know, it's something like, hold on, I'm gonna pull it up. Um, I know that everything's connected, and my dentist would just deal with it in my mouth, but it's like I want to deal with it in my body. So it is Fusobacterium nucleatum, and I just I obviously I don't want to just have this question be about me. I want it to be relevant to other people. So I guess I'm just wondering in general if someone has a bacteria in their mouth, how do they deal with that also in their whole body? Because obviously you don't want to just deal with it in the mouth because the whole body's connected.
Yeah, it's a good question. So I think I caught most of that. You were talking about a particular bacteria that's in your mouth, right? And possibly affecting, you said, your mastoid bone?
Yeah, I'm sorry the sound is poor. Yes, I felt like just pressure, pain, weird sensations like in my ear and the mastoid bone. And like if I go to an ENT, they don't see anything, but I felt it for quite some time, like years. And so I'm thinking, maybe I'm actually hopeful that now that I identified this bacteria in the mouth, that if I deal with it in the body, that could like help my ear and my mouth, that could help me more than just in the mouth. So that's why actually to me it's kind of almost a good thing that I found this because it gives something to work on.
Right. Okay. So, I mean, whenever we're dealing with any sort of latent, hidden infection in the body, what usually needs to be the first priority is finding where is the foci, which is an accumulation of it, and the mouth, the oral cavity, the roots of teeth, and in worst case scenarios, going down into the mandible, which is the kind of chin bone, and then also the maxilla, which is the bone that's above it, that's the top jaw, and usually this is associated with really kind of chronic health issues, and there is evaluation that's done there. They're finding, there's like a particular root that's infected, and then that root is connected to the bone. And there's usually localized symptoms, whether it's tenderness or touch or pain or some sort of like symptoms here, and then there's the whole systemic effect. I agree with you that if there is any sort of infection of any type that's found, there should be local intervention. So I think you mentioned things like ozone, which I do think is probably the best approach to address something like where is that local issue. And then also systemic. And what I mean by systemic is helping your body's immune system just do its job, which is eradicate what shouldn't be there. And so I don't think you need to do systemic antibiotics necessarily, which some, I guess, alternative doctors that specialize in chronic infections sometimes do. Maybe those should be reserved for things like chronic Lyme infections, actually tested bona fide infections. And the other approach is more so like, what else can we do to help our immune system? So that's where adaptogens come in, mushrooms that are helpful, certain particular nutrients, orthomolecular nutrients. Of course, the vitamin A, D, and zinc are the top kind of three ones that help with that. Vitamin C always is a top one that helps our body's immune system because it's used by the white blood cells so much in infections. And so that's kind of, I would say, the more kind of gentle, systemic, natural approach, along with, okay, where is the infection? Let's treat it. Last thing I'll say, mastoid bone is right back here. And so this is a pretty severe infection if you do get that. This is a medical emergency. Usually teeth, in my experience, don't connect so much with this. This is like, usually there's some sort of ear infection that goes and causes something called mastoiditis. And that is, again, probably going to be quite severe if it is at that point. So that's hopefully helpful.
Thank you. And I'm not. It doesn't feel severe enough to be mastoiditis. So we're good, Thank you for all that. And I guess I was wondering, like, do you? And again, I know you can't like tell me like specifically amounts or, specifically you're not my doctor or anything, but like, do you as a naturopath, instead of like antibiotics, are there herbal antibiotics that you would tend to use sometimes? Or
Yeah, so there are herbal antibiotics. Again, the difference between herbs and pharmaceutical medicines is that, generally speaking, pharmaceutical medicines, in most cases, not every single one, they're a little bit more specific, and they also have more side effects. So when I say they're more effective, if there's a very specific thing that needs to be addressed, like this particular marker needs to be reduced or this receptor needs to be targeted, that's what pharmaceutical medications are very good at. And natural medications, including ones that support the immune system, are more generalized. So like there are herbs that have antiviral effects and antibacterial effects, but they wouldn't be as strong as something like interferon, which is like given to people that have some major viral infections or something that is quite severe. So we kind of take a more supportive approach in severe infections, ones that have actually been diagnosed and identified. And then, if it's more like a chronic latent infection, you can definitely work with providers that are comfortable doing protocols to address those types of chronic infections. And so that is typically not something that I do in my practice, so I can't speak to anything more specific than that. Because it's an area that's just so, I'm going to say, specialized, I usually refer to colleagues that have a focus in chronic viral or Lyme infections. But I know enough about it that there are protocols, but they're sometimes just complementary to things like antibiotics, or they're kind of used between antibiotics, let's say in chronic Lyme infections.
thank you. Thank you very much. One last little question. If someone has like a chronically low IgA, besides taking vitamin A, what are ways to like raise that?
Yeah, so I'm assuming the IgA, is this on blood or is this like on GI testing?
Blood.
Yeah, blood. Okay, so I mean, I think in general that's your first line of defense immune system. So of course, vitamin A is usually the first thing. So support all the areas, primarily the digestive tract, which is where the first place that IgA is active. So things like certain probiotics, like Saccharomyces boulardii is one that comes to mind that has these benefits. There are some nutrients that actually give you some of these cofactors like IgA, like colostrum, for example, which is like the first milk that a mother, whether it's a cow or human, gives to their babies. It's very rich in these immunoglobulins, and they help with supporting IgA's action. And then, if you have chronically low IgA, the root cause is what's making that chronic. Is that a genetic abnormality, or is that something that is actually depleting it? Like, go after that chronic infection. And so I think it kind of makes sense if you're dealing with chronic infections here, then we look at what that could be, addressing that, and then the IgA kind of comes up if that chronic infection is suppressing your IgA. Think of it like it's just using up your immune system, and it can't kind of keep up with the production. And lastly, I'll say, I've already mentioned medicinal mushrooms. I think that whole family, and then you can get into the specifics, but things from like chaga, turkey tail, maitake, shiitake, you just go down the list. There's a whole host of well-researched medicinal mushrooms and specific extracts that can actually be helpful to support your body's innate immune system, which is what IgA really does. And then there's also something called thymus extract that maybe you can ask your naturopathic doctor to look into. So medicinal mushrooms, and I would say, thymus extract could be helpful.
Thank you very much.
All right. There's a couple questions in the chat, and then I was thinking we could maybe go over the new program. We are just a few days away. So there was a question. Over the past couple of weeks, I find that as I'm reading, I realize that I have misread a word. I also misuse or use the wrong word when I'm speaking. Any thoughts on that?
Yeah. So,
I had the same reaction when I read it too. Like it could be a whole bunch of things, but I mean, it's possible that just your visual system is skipping over those words, and that's possibly what's happening. But it also, I've seen it before, like it's possibly like just a cognitive processing issue. And overall, the approach that I would take, and sorry for cutting in, Cam, but I would just like have I would be following the Concussion Fix diet, doing everything possible, trying to hunt for areas of dysfunction that is in the visual and cognitive system. And I would, again, try to implement everything in the Concussion Fix program first. And then if that's still there, that's when you start looking at, occupational and maybe even like if it's a reading thing, there's certain occupational therapies that specialize in this area. But that's how I would approach it. Cam, maybe you have some thoughts.
Yeah, also like most cognitive problems in PCS cases are actually related more to like anxiety. And this is what the research says. So this isn't just me saying this. This is what the research shows. Is that a lot of these cognitive processing problems that are self-reported by patients tend to be highest in those that have underlying anxiety. And so what can start to happen is that all of a sudden you notice that it happened once, right? You're reading and you're like, oh, I skipped over those words. And if you just move on with your life and don't get concerned about it, we all do those things, right? Like the other day we were hosting a party and I was like, I forgot like this person's name that I've met a number of times. I'm just like, what is his name again? Like, why can't I think of his name? Right? And so to the concussion patient, that becomes, oh no, this is a problem. But to the non-concussed person, you just realize that's just a part of life, that every once in a while we have this little brain fart that we're like, why can I not think of this person's name? And we move on with our lives and it doesn't really impact us. And so I think we have to try and separate what's pathology versus what's not. So reading, people will skip over words. You go back and you read the same line, that's fine. But if you start attaching emotional significance to it, for example, there was a paper that came out a couple of years ago, and they just talked about cognitive problems in PCS, and they called it Memory for Forgetting. And I thought it was just an interesting title. And what it talked about was this condition called functional cognitive impairment. And what functional cognitive impairment means is that people self-report cognitive problems, but they test completely cognitively normal. So they have no underlying cognitive function, but they think that they have a problem. And so one of the kind of things that they brought up was that many concussed patients will tell you that they have memory problems, but yet they'll be able to tell you in perfectly great detail about all the times they forgot something. Right? Like, oh, just the other day I went out to my car and I had my car keys in my pocket. They were in my hand 2 seconds earlier and then I couldn't find them. I couldn't remember where I put them down. And they're going through this whole story. They can remember every step by step detail. That tells you right there, because somebody with true kind of memory or cognitive problems wouldn't even be able to remember that event had occurred. But yet these people can tell you in great detail every step along the way. So this is just kind of those kind of forgetfulness moments where you're distracted, you're doing other things, you got your sunglasses on your head and you spend an hour looking for them because you're just, thinking about a million things. So it's important then to separate it. And one of the things that they said in this paper is that the reason that this exists and the reason that people think that they have these problems is because of the emotional significance that they attach to it. Because if something comes with emotional significance, you tend to remember it more than if it didn't. So things like, okay, I'm reading through the page and I, missed the line that I was on. That could be an ocular tracking thing. That could be neck dysfunction if your eyes are skipping and not tracking smoothly. But if you start to worry about it, then it will happen more frequently, because anxiety can also cause that. So if you start to worry that there's something wrong, it will start to appear more frequently. And then the fact that it appears more frequently will increase your anxiety and cause it to appear more frequently. And then you start to spiral into thinking, I have something really wrong, when meanwhile, all it was a couple little weird lapses that then you attached emotional significance to, and then you start to see examples of it everywhere. So I want to really separate this, that patients with persistent concussion symptoms, even though often complain of cognitive problems, test cognitively normal in most cases. And I've talked about this with a ton of neuropsychologists that specialize in this area. They test brain function. They say most of my PCS patients will test completely cognitively normal, even though they think they have a problem. So here's the question, right? When I'm reading, I realize that I've misread a word. Okay. I think that we don't necessarily want to pathologize that. Or I misuse a word when I'm speaking, okay? Now, again, if we start to attach emotional significance to that, what happens is we start to think about it more and more, and then it trips us up when we're speaking, and we can start to cause more and more of that to occur. For example, I have a stutter, but it only comes out when I'm anxious. So if I'm going to speak on stage and there's 500 people there, there's a good chance that the first, 3 sentences out of my mouth will be like stuttered. Whereas once I get into it and I calm down, that all goes away completely. But if I started to worry about that stutter, then I'm just increasing my anxiety, which is then causing, because when you have anxiety, your cognitive function suffers. You're not able to process things as well. And then you start to have those things, right? So my stutter will only come out if I'm nervous, right? Like if I meet a celebrity, I'll probably stutter. it's just how my brain works. Is when I get anxious, it just gets all messed up. And so I think that's something to consider. I'm not saying that's definitely the case, but like Dr. Hrkal said, I think that there's a whole bunch of different things, right? So what can cause these lapses in cognitive function, right? Inflammation, autonomics, anxiety, neck function, anything. So what we typically do when it comes to cognitive problems, and in the new program, if we're going to show you here in a second, cognitive function is after rehabilitation. So like I said, if you look at the concussion recovery pyramid, rehab is at the very top. Cognitive function we don't even put on the pyramid, but I put a module on cognitive function right at the end of the course. And the reason it's at the very end is because it's related to everything before it. So if you have done all those things and you get to the end and you're like, there's still something going on cognitively, now it's time to explore. If you have symptoms, like if you have headaches, if you have dizziness, if you have any type of somatic symptom at all, you will have cognitive difficulty because of those symptoms, right? It's pretty hard to think straight if you have anxiety. It's pretty hard to think straight if you have a headache 24/7. So the first step is to get rid of all the other symptoms. And if you get rid of all the other symptoms and you're feeling really good, but except for I still have these cognitive problems, then it's time to go and actually get assessed. Go and see a neuropsychologist. The neuropsychologist will run you through a whole battery of tests and compare you to other people of your age. And then they'll either tell you, actually, you're normal, in which case you can probably stop worrying about it, or, yeah, you have some problems, in which case they'll give you specific things you can do to target those specific problems to help you build that cognitive function, right? And because it's speech related, it might be a speech language pathologist, it might be an occupational therapist, right? So when it comes to cognitive, if you have any other symptoms, don't worry about cognitive. Fix the other symptoms first, and cognitive will probably take care of itself. If all your symptoms are gone and you still have cognitive, then it's time to go and investigate. So step one would be some sort of cognitive evaluation, followed by either you're normal, and in which case it's probably more of an anxiety or kind of self-fulfilling prophecy, right? You're starting to see these things, and once you see it once and you attach that emotional significance, you see it more frequently. Or there is something there, and then we can give you specific things to do for that. Okay, so that's kind of my long-winded answer about cognitive function, is to save it for the end. If you have any other symptoms going on, forget about cognitive, because that will probably take care of itself when you address all the other things. And if it doesn't, then we start looking at it.
Yeah, I second that, Cam, totally. Like you have to really clear the deck before you can realize like what's driving the cognitive function. The last thing I'll say, just in the way of analogy, the way I explain this is that one of the hallmarks of PCS is trouble processing sensory things. And so you have to think about, there's like almost like now an overwhelm, a logjam where like your visual system, your cognitive system, your sensory systems are all running through the thalamus. And now this is where you get light sensitivity, noise sensitivity. You're sensitive to a lot of these things. A lot of systems like the autonomic nervous system help regulate that and smooth that process out. So without pre-PCS, you can do a lot of different things and still feel very cognitively functional. However, now there's a huge logjam. And so, of course, if all the info going in is also going to impact info going out. And so that's where I think when you're like saying things or thinking about things, it takes longer for people to process things. I've had patients that, exactly like Cam said, they have like a stutter. They have like actually like shaking, like, so there's motor dysfunction. So just like on a really 30,000 foot view, there's just issues with sensory processing and also and also output. And that part of that output is cognitive. Part of that output is typing, which some people are saying here in the chat. So you have to look at that as like, we just have to address the whole system from mindfulness to diet to rehabilitation, because ultimately what those things do is that they improve neuroplasticity. They help the repair of the areas that could be dysfunctional. So let's just say, okay, there is something in some cognitive center that maybe let's call it the language center, because there's a language area of the brain that's a little bit dysfunctional. Let's just hypothesize that actually is. It's not coming from anxiety. The solution ultimately is still going through all of these things, normalizing all these systems, because along the way, you're going to be more functional, you're going to be able to do more things, you're going to get more blood flow to those areas and ultimately support neuroplasticity. So that area is going to heal anyways. So whether you know it or not, you're actually doing cognitive rehab all along until you get to the point where those symptoms are gone. Because if you're like, no, I have issues with typing, and you zoom in on that, what's the conventional medicine solution to that? Okay, go see a speech language pathologist, or go see some kind of specialized occupational therapist, or a neuropsych. But that's still skirting and missing all the underlying things that are driving the reason that you're having these dysfunctions anyways. So stay the course. I know it's frustrating. I know a lot of people associate a lot of that with their livelihoods. We totally get that. But we've seen hundreds of patients go through programs like this and have all those cognitive symptoms dissipate and dissolve after they've addressed these underlying root issues.
Yeah. Cognitive comes last. So don't worry about cognitive. It's just another symptom. It could be related to inflammation, could be related to autonomics, could be related to neck function, could be related to visual function, could be related to anxiety, could be related to anything. So as you go through and tackle all those, cognitive function generally takes care of itself. And for the 0.5% of people that it doesn't, then you start exploring. But don't explore now, because then you'll get pathologized. And because if you have a headache, your cognitive function is going to show potentially abnormal. Yeah. And then you're doing rehab for no reason when you should be focusing on getting rid of the headache.
Totally.
Awesome. I know for mine, it was all autonomic nervous system when I had speech impediment and everything else. When I joined the program, like there was a disconnect between my brain and my mouth, it felt like. And it was the more anxious I got, the worse it got. So it always came out was when I was on the phone with the car insurance, because mine was due to a car accident. And it just like would blow through the roof, where I'd have to literally stop and just breathe. And then it would go away or improve a little bit so I could actually have a conversation, and words weren't skipped, meaningful. The words I actually meant to say were said. So it's yeah, absolutely.
Right. Again, and then if you think about what anxiety is, that's just your body's going into fight or flight, because there's something there that's like increasing your, your sympathetic side. And so it's all kind of interconnected.
A great example, Nikki. I think hopefully, again, it's like all of the processing, the systems that are keeping those smooth processing things happening are just dysfunctional. So correct those, and the processing returns back to normal. Exactly. It's like, honestly, like I've been thinking about this, and this probably is a segue into some of the course after we just re-record everything. We classify concussion as a brain injury. I actually hate that term. Now, the more and more I think about it, is that it's actually your brain is not injured. It's like the software that helps the brain run that's injured. When we think of brain injury, we think of exactly what this person's asking, like, what part of my brain that deals with, speech and language is broken or dysfunctional? Well, it's not really, your brain's not injured. It's your systems that help your brain do its job that are injured. So that whole name is actually a misnomer in most
Yeah.
cases.
Well, that's like the John Letty quote from like, this is back in 2007. So, what is that? 12 years ago or something. And no, more than that. That's 17 years ago.
Yeah, so more than that.
So yeah, almost 20 years ago there. And his quote was, concussion, although primarily and initially a brain injury, results in more than just a disturbance of cerebral function. It affects multiple systems throughout the body, which then drive the persistence of symptoms.
Yeah.
So it's like, yeah, concussion was the inciting event, but what you're dealing with now is just dysfunction in one or more of these systems. And all we're trying to do is help you to correct these systems, which are all fixable. We just got to kind of follow the steps and do the process. And then the symptoms take care of themselves. They go away once you fix those underlying kind of,
For sure.
things. And then there's kind of a follow-up here regarding forgetting of names. This is from misreading words, etc. What about when others are spontaneously reporting to the person that they seem to be more forgetful or slipping up more often? I'd still test as normal or within range of normal, but my spouse comments on this. I mean, I think that because with concussion, the expectation is a change in cognitive function, because everyone thinks, well, it's a brain injury, you've injured your brain. And then we start looking for examples of it. And then even somebody that's on the periphery might be looking for examples of it. And anytime you slip up, they might reiterate or show you that, hey, you made a mistake here or something like that. And I think that's all part of the process, right? Because yes, cognitive function is impaired if you have anxiety, if you have autonomic dysregulation, if you have symptoms like somatic symptoms like headaches or dizziness, your cognitive function will be somewhat impaired. So it's still the same situation. It's just that somebody else is picking it up versus the individual themselves. The process is still the same. Fix the underlying systems, cognitive function will improve. If it doesn't, then we go and start getting it tested. But don't start getting it tested and worrying about cognitive function until all the other symptoms are gone. Because then you'll truly know, okay, there's still something here that I need to get addressed. But other than that, like the treatment for like cognitive decline, for example, I have an uncle right now that is Paul knows him. This guy is just, going through some cognitive decline. But, all he eats is like pasta and sandwiches for lunch. He drinks a couple whiskeys every night, and then so what do? Well, we try to reduce inflammation. We get him to change his diet. We're not putting him into cognitive rehab. We're trying him to fix the underlying dysfunctions that's probably driving this cognitive decline in many ways. Start exercising more, right? Let's improve blood flow to the brain. Get regular good sleep to clear inflammation from the brain. Start eating better. Stop drinking 2 whiskeys every night. Cut out the alcohol, cut out the gluten, start eating, whole foods, fruits, vegetables, and high quality, protein. And within a few weeks of doing that, even his daughter was like, wow, he's improving. Right. So again, this is, it's not going after necessarily cognitive. It's fixing the underlying dysfunctions that cause cognitive.
Mm-hmm. Yeah,
Great.
for sure. All right, Nikki.
All right. So great discussions today. I love it when we can go deep like this.
Yeah.
Well, because we had only a couple questions, right? So
Yeah.
Right. I know.
sometimes those sessions are good because we can actually expound on some of the things that we hear and see.
All right. So share my screen. So the course itself has gone up several hours. It's just under 30 hours, all of the videos. But as I'm starting to watch it, the instructors have done an amazing job of really narrowing in on each topic and answering a lot of the questions that we are getting in the program itself, which is really, really, really awesome. You can see here we've got the welcome, and then some of the topics, some of the modules. What is a concussion? Including, did you even have a concussion, which is a question we often get also. Why you're still having symptoms. Dr. Marshall does a really good job of explaining that still. The return to activity is one that's really, really going to be great. We get a lot of questions about the return, how do I return to work? How to return to sports? School will be the same thing as work. Return to driving, a lot of driving issues. So these are going to be really, really great to have into the program now. Melinda goes a lot more into detail, gives a lot more actual activities to do throughout the program in the recovery mindset, and then also in her regulating the nervous system module. But Dr. Hrkal moved up sleep. Where did it go? Here it is, which is really, really great. Because I know, especially over the last little bit, Dr. Hrkal, you've mentioned a lot that sleep probably should be a little bit lower in the recovery pyramid because it does affect so many different things. So it'll be nice to kind of have that earlier on. And then really more of those concrete examples that Melinda has in regulating the nervous system and doing a lot of hands-on activities at home where you can see, what works for you, because there's so many different options that people can do and not everything's going to work for everybody. So you'll have some options as to, okay, which activities can really help me, maybe when you're out in public, when you're at home, whatever the situation is, and really tailor it to what works for you, which is going to be really, really nice. And then Dr. Hrkal really goes into depth on the gut-brain axis for the nervous system as well, which is really, really awesome. It's more like narrowed in on everything, but you've expanded on so much more. Like it's hard because it feels like it's, kind of saying both things.
We made it more like organized,
Yeah.
and more detailed, but we've also made it more bite-sized in each lesson. So it's easier to go through. So and also the big thing is that we've had 5 years of people going through the program, and we've learned so much from you, the people that have been going through it. So, I mean, that's all been poured into that. Like all the questions we get all the time, now sometimes you'll notice that they're a module or they're a lesson, I should say. And so we've actually taken that feedback. So I think that's what made it so much, I think it's going to be so much more effective for people going through the program.
Yeah, like even your nutrition section, more detailed, a lot of the questions that we do get, you get so many questions about nutrition. I think every day you're getting questions about, simple things of, is this allowed? Is that allowed? Things like that. So hopefully this will really, really help with a lot of that. Even, the supplements, hormones, so many different things. And then again, Dr. Marshall comes in again at the end, where we're at the top of the recovery pyramid, again, looking at the rehab, exercise, neck dysfunction, vestibular, cognitive, right? As we discussed a lot today, it's the very last thing. And then maintenance, right? How to maintain this afterwards, because a lot of these things you don't need to necessarily do lifelong, but a lot of the things you actually just integrate into your day to day and become natural for you to do. It's not like you have to cognitively even think about like, oh, am I doing this today? Right? You can just check in with yourself throughout the day and be like, how am I feeling? And that has nothing to do with PCS years down the road. It's just recognizing yourself and making sure that you're feeling good today and what can I do to be in the best health even after PCS. So there's a lot more.
The other thing we did is we added in a lot more outcome measures.
Mm-hmm.
So rather, like the current program only has 3 kind of symptom scores, right? One at the beginning, one at the middle, and one at the end. And what we wanted to do is almost put one after every module so that you'd be able to kind of see which element was the biggest trigger for you. Like, oh, right after like the sleep module and I fixed those areas, my symptoms dropped substantially. It just helps you to figure out like what elements you need to kind of hone in on and pay attention to, because those are the ones that had the biggest impact for you. And it also helps us to see like what percentage of patients coming in have these particular issues, and then where do they see these drops. But everyone's so different. So it's I think it's going to be good for you to kind of track your symptoms over time in a more kind of gradual way to see your early successes rather than waiting till halfway through the program to do another kind of score. It's kind of after each module, you'll do a score to see how things are going. And I think that'll just help with motivation for people to continue kind of sticking with things. But yeah, it's a lot more robust, but also we tried to be as concise as possible in the modules to keep them short. But kind of zero in on each of the topics and a lot of the questions that we covered generally in the live sessions. Rather than having you sift through all the live presentations, we try to incorporate as much of that into the program itself so that it's much more stepwise and not kind of all over the place, just all concise and at the right point. So yeah, we're pretty proud of it. I think it'll be even more effective than the current version, which is already really effective. So
Yeah. Can you talk a little bit, because we have the symptom severity score, which is the one that we've been doing all along, but then we also have the PHQ-8 and the GAD-7 that a lot of people don't know what those are. So can you share a little bit
So
about what those are?
the PHQ-8 is a depression screener, and the GAD-7 is an anxiety screener. These have been validated both for adults as well as adolescents. So it works in, teenagers all the way up to, adults. And I think it's important because a lot of people don't maybe recognize that they have underlying anxiety. And so this is just a screen to see, do I or do I not? And I think it'll just give you more insight to pay more attention perhaps to Melinda's section, or maybe when you should be getting some like mental health support as part of your recovery plan. So we added those for each kind of outcome measure section as well, just to see, because you might get halfway through and realize that my anxiety levels are still high and maybe I need to go back and do some work there, right? So it's just another screening tool for that.
Yeah. And, even at one module, if it's high later on in the course, you can always then go back to Melinda's module and help with that, which is going to be really, really nice.
Yeah.
So update as to time, because I'm getting this question almost daily right now. It is in IT's hands right now. We are just working on getting all the right tags, making sure that the transition is smooth for all the members. So it should be any day. It's just IT's trying to work out all the bugs so that you guys don't get it. And then we realize afterwards, like, oh, that didn't transfer over. Oh, that's not connecting.
Yeah.
So we want to make sure it's smooth for everybody. So it's literally any day as soon as they can work out those few little bugs.
Yeah, we just want to make sure that you guys get it, right? Because ultimately the way that all the billing and stuff is set up is that you're paying for this program and we're introducing a brand new program. So we have to make sure that you can get access to the new one in a smooth way. So that's all it is just making sure those tags transfer so the new program is included in your subscription. But you'll have access to both, right? So if you're already going through the original and you're like, well, I don't want to go back to the start, you can stick with the original program if you want, or you can just stop where you are and go back and do the new one if you want. Everyone can make that decision for themselves. Any new people coming in after we do this transition will just get right into the new one. They won't even really realize that an old one exists. But people that are here now, you guys can decide whether you want to stick with the old or move to the new.
Go to the new one. Just get all that extra info. I would.
Yeah. I mean, like I
Right.
said, like one of the things that we always like harp on people is when you get to the end of the program, if you still have issues, go back to the start and just do it over again, because you're going to be in a completely different baseline level, right? Like if you come in and your symptom score is a 90, when you're first going through those first sections, you're probably not going to get as much out of it when your symptom score is so high. But as it starts going down and you go through the program, you get to the end, maybe you're now at a 40. Now go back to the start and you're coming in at a 40. And now you can kind of get more out of those modules as you go through it. We had a guy recover. He was on our Tuesday live session with me, and he had gone through the program like 3 or 4 times. And he would just go back, start it over again. And he's been in the program for like a year and a half or maybe even longer. And
coming close to 2 years. When you
yeah,
told me
and
he recovered,
and
I
he's like,
literally celebrated.
yeah. And he came on just to say, I'm done. Like I've finally hit full recovery. Like I have no more issues. And it took him 3 or 4 rounds of going through it. And so if you get to the end and you're still having some issues, it doesn't mean that like that's it. You just go back to the start and do it over again, because you're coming at it from a whole different perspective. And so just keep doing it. Just keep going back through it, slow and gradual. Don't just rush through it a second time, but actually go through and follow it as if it's your first time. implement those things. And then boom, that'll knock a few more off, and you keep going, and that'll knock a few more off, and you get to the end again, and now you got maybe your symptom score is a 10 now. All right, go do it one more time. Get to a 0 if you that's where you want to get to. So yeah, anyway.
So hopefully that will be any day, as I said. We will let you know, though. We will send an announcement, and you should actually just see it on your dashboard, too. When you go to courses, you'll then see the option for Concussion Fix 2.0. But we will let you know as soon as it is live. So I hope everyone has a fantastic day. Bye.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.